Everyone, I welcome you all to a long awaited Instagram live session with very respected Dr. Saptarishi Banerjee sir. We are soon going to have our followers, and we are going to send an invitation to he is just yeah he when he has joined. Good afternoon, good evening, sir. I have uh, sent you an invitation. Yeah. Good evening, sir.
Good evening. Am I audible, visible?
Yeah, absolutely. You're audible, you're visible, and we all are eagerly waiting for you. I was just talking to all my dear friends that this was a long-awaited live session,
Yeah.
and we all wanted to learn all the indigenous homeopathic drugs and drugs of Hindustan that we have all learned from you previously through your YouTube videos. But this would be an opportunity again that we all can listen to you live, and then this video will be posted on YouTube where students can learn and listen again and again and learn through your generations of your knowledge could be passed on to them.
Sure. Yeah.
Yes, sir. So I just wanted to we started a very simple note that, sir, you have been using drugs of Hindustan very frequently, very successfully in your practice. Can you please tell what are the drugs that you use very frequently, and some short indications, in short, some indications of these drugs?
Thank you, first of all, for inviting me. So it's nice. I haven't used Instagram before very frequently, so I'll be a little wobbly, but hopefully I
No
can.
problems.
Um, the Indian drugs, I have the book with me here. So
Yeah.
if those who don't have the book, it's a really good book to have in a library and a good read. First of all, the Indian drugs have most of them, or all of them, in fact, in drugs of Hindustan, have been used in Ayurveda for hundreds of years, even prior to homeopathy was there. So its authenticity and clinical usage is even verified prior to being used as homeopathic remedies. And many of the indications of these remedies are quite on the same lines as what was used in Ayurvedic literature. So in that way, its ability to help in many conditions is much more verified in many cases. Secondly, about the author, Dr. S.C. Ghosh, you'll see in Clark's dictionary, there has been a lot of mention of Mahendralal Sarkar and S.C. Ghosh, and he referred to those authors. And even many Indian drugs are mentioned in Borike's main section, like Justitia or
Yeah.
Tinospora. It's mentioned there. So authenticity-wise, it's very authentic. So many times, people raise an eyebrow. It's just about tinctures and it's about just Indian drugs, but it is extremely verified and authentic. So the usage of drugs of Hindustan or the Indian drugs came into our family or into our practice, because the indigenous remedies works best on indigenous people. That's what I have learned. Like with Indians, the Indian drugs have a much better action to help such cases. Secondly, many times we come across cases, and especially in today's world, when we find a lot of drug-dependent cases, patients who are on, conventional medicines. For example, like one of the remedies, if you see the index section of drugs of Hindustan, one of the remedies which I use very often in my practice is Carica papaya. You
Mm.
know, Many times you'll come across cases, patients who are on PPIs, protein pump inhibitors, on acid reflux remedies, and you're hardly getting any symptoms. So it's most like a one-sided case.
Mm.
And very many times just they tell you that, I have acidity, I have some reflux, and it's from milk, it's from meat. or it's from some non-veg foods. And very many times, if I do not give a clear picture of the remedy, I start the case with Carica papaya. And these are mostly have been used in tinctures in lower potencies. So, acidity from milk and meat, Carica papaya is a superb remedy. So many times I start with that case. I ask them, whenever you are taking the PPIs or antacids, not take that. Try taking Carica papaya instead. So the patient who was taking the PPIs, or antacids for 3 times a day, I asked them to not take that. Try to take Carica papaya instead. Whenever you feel the acidity, whenever you feel you need the remedy, and the conventional medicine.
Right.
And I've seen, that I did not get a clear picture of a constitutional remedy. I did not get a clear picture of a polycrest. And I started with Carica papaya. I follow up the patient in 3 weeks' time. And they tell me that, I have withdrawn 50 to 60% of the medication. I was taking the antacids twice a day. Carica papaya is helping me. I'm taking it, twice a day, and once a day I need the antacids. So, when you have withdrawn 50 to 60% of the medication, we get to see a much clearer picture for prescribing a polycrest or prescribing constipation. So one of its very useful areas of some of these remedies, and I shared with you those, is using it in drug-dependent cases to open up the case. Like when you have withdrawn, in my understanding, when we have withdrawn 50, 60% of the medication, like this was a natural disease. And due to the constant usage of antacids, it's an artificial chronic disease. You ask him, what is your symptoms? I can't tell you. I take the antacids, that makes me better.
True.
Yeah. So when you have withdrawn a little bit of the artificial chronic disease, you get to see a picture of the natural disease.
True
So
picture.
the true picture. And you get to see more symptoms. The patient is giving you burning. The patient is giving you like a sourness in the mouth. So you're getting a clear picture to prescribe a polycrest. So the Indian drugs will, in most of the cases, may not cure the disease, but it will pave the way for a polycrest prescription. It will pave the way to wean off the conventional medicines. So this is one of the commonest examples I can give you. Carica papaya, superb remedy for acidity, especially from proteins, milk and meat, and I use this very, very often in my practice. In the same context, another remedy which I like to share with you, cases of mucus colitis or ulcerative colitis, the patient is presenting to you with lots of mucus in the stool, and there is blood with the stool, and there's a lot of tenesmus, right? And in that case, again, the patient is dependent on conventional medicines. He's taking conventional medicines for dysentery. One of the remedies which I use very common, if you see, it's I think mentioned there, Atista radics, root of.
Atista radics.
This is a fantastic medicine for cases of mucus colitis, for ulcerative colitis, especially when there is cramps in the abdomen with mucus, blood in the stool. So one of its usage is in that way to wean off the conventional medicine. You ask them not to take the conventional ulcerative colitis remedies. Whenever you get these mucus stools, take Atista radics. The tincture, the dosage is the standard for all of the remedies. 10 drops in a cup of water, 6 to 8 hourly. That's the standard dosage. But so that's one of the factors. And if you look in Atista radics, it's I think 183. If you see the first paragraph, it's mentioned more useful in case of dysentery, either simple or malignant with white or bloody, in which Atista indica fails. Atista indica, to be honest, I haven't used so much, but Atista radics has given me very good results for of mucus colitis with mostly blood in the stool and cramps in the abdomen. So, A, you can use it in such cases where the patient is drug dependent. B, for cases where mercury has failed. You have prescribed Marxol for more the blood, better it is indicated. But Marxol didn't work. And Atista radics in lower potencies, there's 30C, can many times help such cases when mercury has failed. So that's also one of the usage, but mostly I'll say tinctures have given the best results.
Best results.
So Carica papaya is one of the remedies I shared with you.
Yes.
Antibiotics for blood dysentery and with cramps and tenesmus. I'm sharing with you in order of importance the ones
Yes,
which
sir.
most commonly. if you see it's mentioned Tinospora cordifolia.
Yeah.
Tinospora is another fantastic medicine. It's an Indian drug. It's
Hmm.
mentioned in Boric under relationship of, I think, Cyanothus. It's mentioned a Hindu remedy for spleen in Boric. But Tinospora have had very good results in many cases. For example, it is one of your go-to remedies for cases of weakness. So extreme debility. And again, as an acute, many times the patient is on a constitutional remedy. You have given him an order metallicum, you have given him an atramute, and
Hmm.
he's calling you up and asking you, I'm really fatigued. I need to take vitamins. I need to take supplements. Can you help
Hmm.
me with something? So extreme debility, exhaustion,
Hmm.
that is one of the very important factors of Tinospora. And many authors mention that it's known um, as a pick-me-up remedy. Like, patient is on the bed and it will help you to pick up from the bed. So
Hmm.
weakness is one of the very important factors. And secondly, for Tinospora cordifolia, it's also a very useful remedy for cases of fever with weakness.
Fever.
So, there is a
Weakness.
low-grade fever going through, and there is weakness with that. You have tried ferrum phos, you have tried gelsemium, that's not helping. Tinospora is a second line of defense. So,
Hmm.
many times these Indian drugs will work as, plan B when your known remedies haven't worked. Your gelsemium hasn't worked, arsenic hasn't worked for a case of fever with weakness. And sometimes Tinospora, has a very good result in such cases. So, if you see Tinospora in Drugs of Hindustan, it's mentioned under personal. There's a section of personal observations, page
Yes.
3-7, and he mentions turned out to be an excellent remedy in homeopathic practice, found by competent authorities to be an excellent remedy in intermittent fevers, debility. So
Yeah.
that is a very important factor for
Hmm.
Tinospora. If you see the second last paragraph in Tinospora, it's mentioned it is widely used as a pick-me-up remedy where the patient
Pick
has
me
been
up remedy.
extremely weak. Yeah.
Yeah.
So that's, I think, is a very useful area. And thirdly, I use it very, uh, with good results in cases of thalassemia. In
Hmm.
thalassemia, where there's splenomegaly, where there is lots of weakness, the patient is anemic, he gets
Hmm.
frequent blood transfusions, and after the blood transfusion, there's also weakness and fever comes up. Sporine tincture works very well, to revive the system in many cases. So this, I really like to vouch for this remedy. These are very underused um,
Yes,
remedies,
sir.
in my understanding.
Yes, sir.
So this is another one of them. Um, the fourth one, which again I have used with very good results and I like to share with you, is Boerhavia diffusa.
Hmm.
Boerhavia diffusa is a very, very important one for cases of renal dropsy. So when you come across cases of renal dropsy with raised urea levels, raised creatinine levels, um, and there is also in the background anemia, Boerhavia is a very, very useful remedy. Again, in tincture, many times when I do not have a clear picture of a constitutional remedy, I use Boerhavia if there is dropsy, if there is raised urea and creatinine levels, and 10 drops in a cup of water, twice a day. Do a review creatinine urea levels, after 4 weeks time. Or the patient is on dialysis, you're not getting much symptoms, and in such cases, you can very many times reduce the frequency of dialysis as well with Boerhavia diffusa. It's a very useful remedy. Cases of dropsy with anemia, with and especially of renal origin. So that's another brilliant medicine, Boerhavia diffusa. Again in tincture mostly.
Okay.
Fourth one, I should have said this earlier, but this is one of the remedies which I use almost every day in my practice, and that is eagle marmalos.
Eagle
Eagle
marble.
marmalos is prepared from bale.
Yeah.
Bale is a very good uh, fruit for digestion.
Digestion.
Like people who are with digestive issues, they will see them by getting bale and bale kapanna or bale sharbat.
Hmm. Hmm. Hmm.
And eagle marmelos, there are two eagles actually, eagle marmelos and eagle folia. Marmelos
Folia.
is prepared from the pulp, and folia is prepared from the leaf,
Leaves.
right?
Yeah.
So in both the remedies, one of the common threads is both have a lycopodium type of aggravation 4 to 8 p.m. So evening aggravation. The symptoms are mostly, non-specific. I'll say bloating, lot of belching, lot of sourness, So that's common for both. What is common for both is also the evening 4 to 8 p.m. aggravation. But the difference lies with the stool in both the remedies. As folia is prepared from the leaf, so it's the doctrine of signature, it is dry. So you'll find more constipation in eagle folia. Whereas in eagle marmalos, as is prepared from the pulp, the stool is more of a semi-solid consistency or of a muddy, mucousy consistency in eagle marmalos. But I use eagle marmalos very often in my practice, and that has given me very good results for cases of GERD, for cases of chronic gastritis, especially with a lycopodium type of evening aggravation. Patient says, I need antacids. You ask them not to take that. You take eagle marmalos whenever you're having the symptoms. And with very good results, you can wean off the conventional medicines. Sometimes when the patient is coming to us for a private consultation, and they're paying us to see, one of the important challenges is how you can shift them completely from a cocktail of conventional medicines to homeopathy. Obviously the constitutional remedy is the best answer for that, but very many times when they are dependent on conventional antacids, conventional medicines, weaning that off is also an important challenge. And in my belief, in my experience, these Indian drugs have got very good results in such cases. So I really like to vouch for eagle marmalos. Just one thing. Eagle marmalos and eagle folia. This is in page 89,
Yes,
and
sir.
it's mentioned he suffers from headache which appears between 4 to 8 p.m. Compare lycopodium. And few paragraphs below, it's also mentioned all the pain in the limbs are aggravated after 4 p.m. So typically, like a lycopodium type of aggravation, evening aggravation. There's bloating, distension, a lot of flatulence. Symptoms are on the lines of lycopodium. When lycopodium doesn't work, think of eagle marmalos, or in a drug-dependent case, you can also think of eagle marmalos. So, but remember the difference: folia is more constipated, whereas
Yeah.
marmalos is more of a loose stool. That's what I understand.
Yes, sir.
So this is one of the medicines also I use. I also like to really vouch for another fantastic medicine is Blumia odorata. Um, I haven't, very honestly, I'm sharing with you that there are very few tinctures which, or organopathics or Indian drugs which work as fast as Blumia odorata. When you come across a case of bleeding piles, fresh blood, bright red bleeding piles, and there may not be pain, but bleeding is the concerning factor of the patient. The patient is taking pause, the patient is taking conventional medicines to stop the bleeding, but still the bleeding continues, fresh blood. And Blumia odorata as an acute works wonderfully to check or stop the bleeding piles. Obviously, once the bleeding is controlled, you can go ahead with the constitutional remedy after that and figure out how to cure him completely. But it has fantastic action for bleeding hemorrhoids. You find in Blumia's therapeutics that all types of hemorrhages are mentioned, but in our experience, bleeding hemorrhoids is the best usage of Blumia odorata.
Blumia odorata.
So again, in tincture, it's like an acute. Whenever they have the bleeding, 10 drops in a cup of water, 6 to 8 hourly, and you stop it when it's better. If you see in Blumia, page
Yeah.
93,
Yes, sir.
under homeopathic usage, I think second paragraph, homeopaths have found it useful in controlling hemorrhages from the uterus piles,
Uterus
and
piles and dysentery.
in bleeding piles, it is an excellent remedy.
Hmm.
So this is one of the very, very useful areas of
Remedy.
Blumia. Comparing Blumia, if you compare Blumia to another hemorrhagic remedy which is mentioned here, is Cynodon dactylon. Another remedy which I use very often in my practice. But Cynodon's hemorrhage is a little bit different in terms of sphere of action. Cynodon is also a remedy for a bleed, for bright red bleeding. And durba is like the grass, durba grass. And in
Yeah.
Ayurveda, they used to rub durba grass on any bleeding surface. So that's the earlier use. But Cynodon dactylon has got brilliant action, especially in hemorrhage of a respiratory origin. So if you're considering cases of epistaxis, if you're considering cases of hemoptysis, and in such cases, Cynodon has got brilliant action to stop the bleeding. Right.
Okay.
So, acute epistaxis, the patient is having fresh blood, you ask them to take Cynodon whenever they have the epistaxis. Similarly, for hemoptysis, you've tried Acalipha indica, you have tried, other remedies not helping. Cynodon is like a hemostat, it will stop the bleeding. So, both have bright red bleeding, but
Okay.
Blumia is more for hemorrhage of, gastric or hemorrhoids, whereas Cynodon works better for hemorrhage from especially respiratory. Epistaxis have used with very good results, and hemoptysis as well. So this is also one of the, these are many times forgotten remedies. I would say people do not use it so often in practice. Next one, which works quite well and I've used it frequently, is Desmodium gangeticum. Desmodium gangeticum is another Indian drug, especially for acute fevers. When you come across cases, if you open Desmodium, I'll just show that.
Yes, sir.
Desmodium is especially, my understanding is it's a midway between rustox and eupatorium, because you have some degree of muscle pains like rustox and you have some degree of bone pains like eupatorium. If you see in Desmodium gangeticum, first, second, third, fourth, fifth paragraph, it mentions the pains all over the body and headache and other symptoms may be present. That body ache with fever is one of the very good indications for Desmodium. And it helps in a biphasic way. It helps not only to stop the fever, but it also helps to reduce the body aches as well. So very good resemblance to eupatorium and rustox, but also close to gelsemium, because there's a certain degree of weakness and drowsiness in case of Desmodium. If you see the second paragraph of personal observations, intermittent remittent fevers of children where there's sleeplessness or drowsiness and pains all over the body. So that sleepy, drowsy, weak feeling with body ache, the patient is confused whether it's a muscle or in the bone, and there is fever associated with Desmodium, as a very good action in acute cases, and especially children with fever, so that the parents do not need any conventional fever medicines. You'll see it's also mentioned in this respect, it bears a close resemblance to gelsemium. So Desmodium is also very, very useful. If many times people get confused between Desmodium and Tinospora. Remember, for Tinospora is more weakness, like exhaustion is the more important factor for Tinospora. But in case of Desmodium, there's a little bit of weakness, there's a little bit of body aches, there's a little bit of bone pains, and that combination works well for Desmodium.
Like in personal observation, here it can cope with gelsemium. That's what is written in personally. It can cope with gelsemium.
So, like the weakness, drowsiness is similar to gelsemium.
Yes, sir.
One of the things for those who are joining in and like to share this, that many times hearing a new remedy, it sounds very nice. It's always nice to hear it. But when you are seeing people who are paying to see you, who are giving money to take your prescription, you'll be skeptical about using a new remedy. That happens with everybody. The best way of incorporating these remedies in practice is by correlating with remedies which which you prescribe. Now, if you are prescribing gelsemium in your practice day in, day out, you can put in your notes wherever you have your notes that if this gelsemium doesn't work, I'll think of Desmodium in fever with drowsiness. And in that way, that can be a part of your prescribing. So, many times we feel skeptical, oh, this is a new remedy, shall I use it? I haven't used this in the past. But, you're giving gelsemium, it didn't work. Try a Desmodium, what's the harm, in trying that? So these are not your remedies which you start the case with, but these can be your plan B, your second line of defense. If you're not having
yes, sir.
results.
So there is this bipolarity that we observe, sir. When there is a senior practitioner, he's little reluctant to start using a new remedy, and the junior practitioners are very eager to start using these small remedies.
True, true, that happen. But we have to be unprejudiced. The
Yes, sir.
more experience, more we become more prejudiced. Like we have a list of favorite remedies. Although Hanuman mentions should not have a favorite remedy,
True,
but
sir.
I'm sure you'll agree with me that as time passes, these are remedies which I've had results with. I know how to use it.
Yeah.
So going out of the comfort zone is sometimes difficult.
Yes.
So if you try to think in that pattern, that if that doesn't work, this can be my plan B. Then in 1 out of 10 cases, you will end up prescribing Desmodium or these remedies which are not
True,
used.
true. True, sir.
So that's one of the ways of incorporating these in practice. Another one, these are I will say some of the top ones.
Yes, sir.
Last towards the end, you'll find Terminalia chibula. That's Haritaki. Terminalia chibula is a brilliant medicine for constipation. Acute constipation, patient is on laxatives. They've been taking laxatives all their lives. You ask them not to take the laxative, take Terminalia chibula instead. Why and how? Terminalia chibula has symptoms very similar to Naxomica. There is ineffectual urging for stool. So there is ineffectual urging for stool. I'll just open Terminalia chibula. Yeah, if you see, I think page 30, I don't know if the page numbers match. Page 302, stool section. Frequent ineffectual desire for passing stool, but passes very small quantity of feces with great force, or sometimes ineffectual action to pass stool. So, again, I remember it like Naxomica. If Naxomica didn't work, or there's not a clear picture of Naxomica, but there is an ineffectual urging for stool, Terminalia chibula has got a very, very good action in such cases. So that's one of the things. Another associated factor of Terminalia chibula is there's also pain in the right deltoid. Extremities. If you see muscle
Yes.
pain, right upper hand in this region of deltoid. So
Deltoid muscle.
like symptoms like right frozen shoulder with an ineffectual urging for stool. That works brilliantly for chibula. And haritaki, like it's been used since ancient times for constipation as well. So its usage is justified even prior to its homeopathic use.
Yes, sir.
So if you see in the personal observations, he mentions its therapeutic action to make the bowels clear cannot be questioned by anybody. So, but ineffectual urging must be there. Like if you come across a case of constipation where there's absolutely no urge for stool, like a Bryanea or an alumina type of a constipation, that is not where Terminalia chibula will work. So it's not that for every case of constipation you'll throw into chibula. Even if you're prescribing an organopathic, you need to still stick to the 3 basic principles of homeopathy. You have to look at the symptom picture. And ineffectual urging for stool is an important factor. So if there's no urge for stool, it's not Terminalia chibula.
Okay, sir.
So that's also one of the remedies which I have used. Again, for coming back to pediatric cases, especially for worm infestation, you'll see another remedy mentioned is Embelia ribis. It's another brilliant medicine for cases of worm infestation. Embelia ribis. I'll just open that. One of the things which is important for Embelia is you'll many times get liontaria. Liontaria is like undigested food particles in the stools, and that can happen with Embelia ribis. I'm not sure if it's mentioned here or not. If you see in the Metromedica of Embelia ribis, page 152, very useful in diseases of children associated with the preceding from worms, grand medicine, diarrhea, dyspepsia, flatulence owing to worms. Mostly the 2 factors for Embelia ribis, the digestion very much deranged in Embelia because of the worm infestation. So you'll get a lot of dyspepsia, a lot of bloating. The child is not having good digestion. and often the stool is disturbed. There is malabsorption. He's having liontaria with the stool. So it's again a very useful remedy for worm infestation. And obviously, all the common symptoms of worms are definitely there. If you see the third paragraph, other symptoms are irritability of the patient, grinding of teeth, picks his nose, nausea, abdomens are distended. Yeah, stools are undigested. Itching in the rectum, itching in the nose, worms comes out with stools. So, it covers the entire spectrum of worm infestation
Worm infestation.
symptoms. But although the entire spectrum is covered, but focus on the gastric area, that a child with worm infestation, when the digestion is deranged, is having a lot of dyspepsia, there is malabsorption, undigested food particles in stool, and there Embelia ribis has got very good action. I've used this again very often in practice, and if those of you who are doing pediatric cases, it's a remedy which is almost infallible. So that's also another remedy which I used in practice. Another one which I've used off and on intermittently is Achyranthes aspera. Achyranthes aspera, there are two very good uses of Achyranthes. First and foremost, very useful for acute diarrhea. Very useful for acute diarrhea. If you open Achyranthes 51. Diarrhea and boils, these are the two areas where it works marvelously. 51. Yeah,
Yes, sir.
if the personal, no, where is it? Yeah, personal observation, page 56. From the above provings, it can safely be demonstrated that Achyranthes will be of inestimable benefit in acute diarrhea and
Yeah,
colitis.
cholera.
It will be of no news to our readers that the late revered and high priest of a fraternity, Dr. Mahendralal Sarkar, was engaged in finding out the curative virtues of his drug. But acute diarrhea, it's mostly a loose watery stool in what I understand, and that has given wonderful benefits. And also, if you look in the second paragraph, the native Kaviraj of a country and the habit of using the leaves of this plant, both internally and externally, in boils, carbuncles, recurrent boils, acute boils. Again, most often what I've seen, patient is on a constitutional remedy, and I don't want to disturb its action. Give us an acute Achyranthes aspera. Right, in tincture for acute boils and carbuncles, it has very quick action, to completely resolve it. So one is the gastric area, acute diarrhea, especially loose stool, and the second is acute boils and carbuncles. If you see in page 53 as well, personal experience of Ayurvedic usage is also mentioned, results in all sorts of boils, carbuncles, eruptions. So
Yes, sir.
many times we use arnica for acute boils, we use sulfur for acute boils, or a belladonna. Again, if the patient is on a constitutional remedy, it's these tinctures will not all interfere with the action of the constitutional remedy, and give it as an acute. It will take care of the acute state, as I understand. So very good usage and very quick action in such cases. So that's also one of the usage. What else am I missing out on?
Sir, I think we've beautifully completed 30 minutes and we have had a valuable time of yours. Just we'll take two questions. One is my question, and
Yeah.
one we'll take it from audience. Sir, from your experiences from indigenous remedies, are there any good remedies that can help for autistic and or ADHD children, where you can help, we can help in developmental disorders, something which can help them to improve their milestones, or maybe attention span, where their attention span and eye contact is uh, really affected? Is there
Uh,
anything?
it is not there in drugs of Hindustan, but I have used Brahmi with very good results of Bacopa, in higher potencies, 200C and 1M, and that can very many times help, to
Okay.
um, improve the attention. Brahmi is used many times to improve the memory. So Bacopa or Brahmi, it's
Bacopa.
available many times in tablets, but I will suggest the higher potencies work better in such cases. In my
Okay, sir. Okay, sir. So maybe we'll let anybody, if there's any question, actually there were, while you were teaching, there were uh, n number of cases that were coming up. But let's see if there is any question which you would like to take up. You can, maybe if you can also choose from the
Uh,
people have shown so much of love and respect to you, sir. That just shows that how you're not just popular, but you're somebody whom people really highly respect and love. And and while we are doing this for last 30 minutes, there were approximately 125 people who are live watching this, and more number of people will definitely come up and watch this and learn with you.
sure. There's
Uh,
a question how long we can give for worm infestation. This is a
yeah.
good question. Any tincture, if you want to, like for worms, you can give it for a period of 10 to 12 days, and then stop it, and that will take care of the acute episode generally. If the symptoms are better prior to that, you can stop it. Even prior to that as well.
Sir, this one student is asking Gaultheria procumbens, if you can throw some light on Gaultheria procumbens.
Gaultheria, I haven't used Gaultheria procumbens in stomach disorders, to be honest. I have used it for inflammatory rheumatism. I'm not sure if that's the same Gaultheria.
Okay,
Inflammatory rheumatism, Gaultheria works really well with, excessive appetite. So canine
okay,
fever with inflammatory rheumatism, that's the Gaultheria I know. I'm not sure if it's a
okay,
different remedy or not.
okay. Sir, thank you so much. We had a wonderful time with you, and from your very busy schedule, you gave your valuable 35 minutes to us. So we all are very thankful to you. We will keep we always look up to you with as a source of knowledge, as a guiding light for all of us. And when I come to Calcutta, I'll definitely try and take
Yeah.
your time and
So
meet you.
we'll meet soon.
Okay, sir. Thank you so much for your time. Take care, everybody. Thank you for joining. And this was it for today. Bye bye. Take care.